It gives me great pleasure to now welcome our next keynote speaker, His Excellency Dr. Amin Al-Amiri, Assistant Undersecretary of Health Regulation Sector at the UAE Ministry of Health and Prevention. His Excellency Dr. Amin Al-Amiri started his career at the Ministry of Health in 1985 while still pursuing his education. He holds a PhD in blood transfusion medicine from Aberdeen University in Scotland. He was appointed as Assistant Undersecretary in 2006. Currently, as the Assistant Undersecretary for Health Regulations, His Excellency is responsible for the Drug Management Control, Audit and Inspection, Licensing and Accreditation standards and guidelines, along with the Organ Donation and Transplantation Office. His Excellency has written numerous books and scientific publications in the fields of blood medicine, and received many awards from local and international organizations. Your Excellency, it's lovely to have you on board. I'd very much like to hear your introduction. Thank you very much.
Thank you very much. Bismillah ar-Rahman ar-Rahim. Wa salatu salam ala Sayyidina Muhammad wa alihi wa sahbihi ajma'in. Good morning, good afternoon, good evening, ladies and gentlemen. It is my profound honor and it's my pleasure to join you today here and to talk about the longevity which relates to the healthcare sector. UAE is one of the leading countries in the region which it supports the healthcare services and pharma industry. We try to invest on the human's health, and this came by investing on the infrastructure which relates to the health and pharma industry. UAE now, as per the great support of our leaders, became #1 outside United States of America in having the highest number of the governmental and private hospitals accredited either by JCI, Joint Commission International in the state, or Australian or Canadian accreditation body. We as the UAE became #1 after the United States of America, FDA or EMA, which stands for European Agency for Drug, and registering the most innovative drugs to support the human being and also to support their wellness, their wellness, and to be able to expedite the process of providing innovative medicines to the people here and to support the medical tourism. We invested on the human beings and we invested on the healthcare services rapidly for less than 20 years, which heavily and strongly the government of United Arab Emirates, either through the Ministry of Health and Prevention or the local health authorities such as Dubai Authority or Abu Dhabi Department of Health or the Presidential Office of a Scientist, and not to forget the private sector, which they are our strategic partner in supporting the healthcare services in the United Arab Emirates. As per the statement of His Highness Sheikh Mohammed bin Rashid Al Maktoum, the Vice President, Prime Minister, ruler of Dubai, that your health is an investment, not an expense. The more we invest on the healthcare services, the more invest will be reflected positively to the human being and will support the longevity in healthcare services here in the United Arab Emirates. Although the more we invest, the more we gain positively. And therefore, it's very important for the governmental and private hospitals and healthcare services to invest on the capital of health and to make sure that we will be able to provide the highest quality of care into our services and to make sure that our people who lives in this beautiful country, the United Arab Emirates, we invest on their health in which it will go to be a wealth. And this is the health and wealth is very much connected to each other. As this slide shows to you, one of the evidence, it's very clear internationally and mainly in United Arab Emirates that the actual and anticipated increase in number of elderly people due to the developments of our healthcare services in many sectors. On the left side, advance in healthcare services, which we are providing through those accredited internationally hospitals and health centers, infrastructure development, in terms of the number of the most eminent hospitals based in the UAE now, as a strategic partnership between the government and international hospitals like Cleveland, Abu Dhabi, and we have American Hospital in Dubai, which they have affiliation with Mayo Clinic. We had Seoul National University hospitals, which they used to run Sheikh Khalifa Hospital in Ras Al Khaimah, and also the Global Health from Sweden, and InterHealth Canada, and many different international hospitals and specialized medical centers, which they are based in the UAE. Third comes improved sanitization and hygiene through the pandemic situation, which has protected the health of the people in the UAE and supported the longevity of the health of the people or the population of the UAE in general. Improved nutrition by the public awareness and a strong healthcare medical education. And the last is a better education, which we are providing the people, not only through the universities and academia, but also through the youth and the young generations, which we are strongly investing on them and providing them with highest standard of educational program and public health awareness. It shows on the right side that United Nations expects 28% of the global population will be above age of 60 years of old. And this is very much applicable in the United Arab Emirates, which the next slide will show to you that the demographic shift in the global workforce is very strongly shown here in this slide. And the elderly people will also play a bigger role in workforce, which the people will retire at the older age. And the workers above 55 years old will stand for more than 18% of the total workforce. This is globally, and it is very much experienced in the United Arab Emirates, that we have plus 55 or years of age are the majority of the people which they are supporting the government and the private sector. The investment of the UAE from the federal and the local government invested very heavily in achievements as a long-term longevity. On the top of it is the life expectancy at birth, which has been reached almost 79.8% by 2018, but with the new figures, it almost reaches more than 81 year. But the most important, or more important, is the healthy life expectancy at birth, which it reached 66.7 by plus 1.8 years, in which we are expecting by end of 2021 will be reported soon to be above 69 years of age. And this is a sort of a support and evidence that how much UAE invested on the human's health and wealth, and how much supported such investments on the longevity of the people's life in the United Arab Emirates. That such achievements needs different type of support, and those supports has been also indicated in achievements with the 4 main initiatives, which was indicated from the federal government as a national indicator of achievements of the United Arab Emirates. On the left side top, the smoking cessation. In 2010, the number of the people, smoker people, were 11%. By end of 2018, we reached just 9%. Obesity, we were 37%. It has been declined to 28%. And diabetes, which is one of the major, with the obesity, the major of the I can say the pillars of NCDs, which is a sort of a main source or a main reason behind having the higher rate of death worldwide, is the non-communicable diseases, which is the NCDs. as the WHO and United Nations stated in 2015, that the global economical burden on the government stands for 832 billion US dollar, which was expected by 2023 to reach 1,032 billion US dollar through the NCDs. And therefore, we worked very strongly and very aggressively to minimize the prevalence of obesity, smoking, diabetes, and different national indicators here in the United Arab Emirates. Now, such initiatives, such outcomes and achievements needs an infrastructure despite the hospitals and health centers. The main infrastructures is the legislation, the factors affecting health longevity. We needed a federal legislation supports the healthy longevity, and those are some sort of legislations which it supported the longevity in education, fitness, and adaptive lifestyle, healthy lifestyle, which has been spread all over the country, introducing of the new technologies and new innovations like wearable items that it could help the people to provide them with sort of monitoring while they're at home or at their offices, and they can be connected with their family physicians while at the hospitals and health centers, and not to expose them to the hazardous or risk to go to the hospitals, and how we will be able to monitor their health. Despite that, the contribution to the community and work opportunities which it was provided to them, and the most important here, physical and mental health and access to the healthcare services today in each single hospitals, and the majority of our health centers, private or governmental, mental health is a big part of their function. And therefore, there were a huge number of initiatives and legislations which it supported the longevity of the people in the UAE. And those are some of the existing laws and the new laws which it was implemented and released by His Highness the President of the federal government, Sheikh Khalifa bin Zayed Al Nahyan, and also the decrees from the cabinet released by His Highness Sheikh Mohammed bin Rashid Al Maktoum, Vice President, Prime Minister, ruler of Dubai. Let me talk about the Federal Law number 9, which was released in 2019 on the right of the senior Emiratis. Federal Law number 13 in 2020 on public health. We had the law 2016 on organ transplant. We had the law for medical liability in 2016 for medical liability. We had a huge number of the laws which it supports. The future plan includes preventive measures to give a sort of personal care by introducing new technologies, which it supports the youth of today and the future people of our country, the United Arab Emirates. Despite the legislation and the infrastructures and the hospitals and the technologies, we planned for 50 years from today, 50 years from 2021 until 2071, which we will be completing 100 years of success and 100 years of independence, 100 years of prosperity in this beautiful country, the United Arab Emirates. And those are 8 main pillars which we are concentrating on by sharing the ideas, the brains, and the initiatives from the people who live in our country, the United Arab Emirates, concentrating on healthy, active community, by concentrating on mental health, strengthening the health and research, and mainly with academia and different universities in the UAE, and also the science park in Dubai and the science park in Sharjah, chaired by my brother, His Excellency Dr. Hussain Al Mahmoudi, and the smart innovative healthcare services, which has been introduced by using artificial intelligence and using the public health vigilance to support our community. such initiatives and such main pillars of the healthcare services for the future of UAE by 2071 came up not from us as alone, the Ministry of Health and Health Authorities and private sector, but I will say it came by a joint integration efforts from the public, from the people who lives in this beautiful country. We are the most global country. We have close to 200 nationalities, and therefore we admire their suggestions, their brain, their ideas, their initiatives. And this takes me to the last slide, which shows the statement of His Highness Sheikh Mohammed bin Rashid Al Maktoum. As he stated, human beings, their ideas, innovations, dreams, and connections are the capital of the future, because where great minds go today, great things will happen tomorrow. And therefore, the great people who live in this beautiful country, they are the ones who supported us to achieve this level and to achieve our mission and our vision for 2071 with the prosperity of the United Arab Emirates and longevity of the people and health for 2071. Thank you very much.
Your Excellency, thank you so much for your valuable insights that you provided into the future of longevity and the leading role of the UAE on our global stage, and indeed the invaluable efforts of the Ministry of Health. Thank you so much to both of our esteemed guests, Your Excellency Hussain Al Mahmoudi and Dr. Amin as well. Thank you so much for joining us. It's been an absolute honor.